with you here. All of us have, today's program is going to talk about mostly about women or an effect that causes women to have some undesirable issues. Now, guys like me, we don't really have to worry about ovaries because we don't have them, right? And we're going to talk about ovaries and some of the things that women have. And yet, even though we don't have them, we definitely have someone that we love. That's a woman, a sister, a mother, a wife, a neighbor, just someone that's our friend. And so they need to get this message, right? So we're going to go ahead and get started. We got everything already recorded. I did it in advance. Boy Scout here, I'm prepared and all is ready to go. Now, if you have any messages or questions through the program, go ahead and text me on the program. I'm doing better at checking those at the end of the web class to see if I can answer any of those questions. So let's go ahead and take the picture away from me and go right into the presentation. And that looks good. And just got a new computer here. And so the buttons are a little bit different places. So let's go ahead and get started. Welcome to the 3 Believe weekly program that comes at you, sharing information about wellness, information about health, and everything to do with it. There you'll see, let me see if I can get rid of that picture. Click here and see the button. Like I said, the buttons are a little bit different. We get used to doing things a certain way. And so we're going to turn. There we go. All right. So any of you that want to get more information about the wellness program, there's our website. Make sure that you click in with the person that recommended that you come so that they can help you most efficiently. And there is our phone number if you get frustrated or have any questions, and we're glad to help you. So a little bit of background. I'm a food scientist. I specialize in chronic disease and metabolic syndrome. I've been doing this for almost 12 years now. I work with doctors and clinics all over the country. We set up a new one this week. I'm doing some training, always fascinating, exciting about the genuine interest of doctors learning a healthier, better way to serve their patients. And the reason why they are is just because it doesn't matter where you're at in the country, the average is these statistics. People are overweight, they have high cholesterol, have high blood pressure, too many are diabetic, thin people walking around, sadly enough, not overweight, 25 to 32% of those people have fatty liver disease. That means that they're already insulin resistant and they're not even heavy. And so these are issues that the doctors are concerned about. If you look at your neighbors, your family members, your loved ones, your friends, they have at least one of these 4 issues. And that is too many of the people we love. There's me. I need to change that slide. It's 12 years ago now. I was 280 pounds, a robust young lad, too heavy for my good being. I had over 10 chronic diseases, refused to take medication, wanted to find a holistic way. That's how I got into this crazy business. It changed my life. I did it without medication, did it in 12 weeks, lost 78 pounds, and lost all of my chronic issues, all issues like high blood pressure. I've kept it off, doing the same things that I tell you about and the new things that I'm learning. So just a quick disclaimer, I'm not a doctor. I'm a food scientist, and but that doesn't mean that this information should be used for medical purposes. You only use it for informational purposes. Always consult your doctor when making a lifestyle change. And the content herein is examples shared from personal experiences, mine and some other people, and they never, ever claim to be a cure or disease to ailment, and that keeps us out of trouble in my legal staff. So we're going to talk about a program that we got from Dr. Tim talking about PCOS and insulin resistance and its opportunities that it provides. Now, PCOS stands for Polycystic Ovarian Syndrome. Insulin resistance, well, you know what that is. And to you guys out there, why should you be listening to this message? I'm going to talk about why you should be, why it's important that you know about PCOS and its effect on our lives. So let me ask you, of the events that happened in 1977, of all of those, it was an extraordinary year, all right? If you can recall any of those events, I'm going to go through some major events, and I want you to pick which one you think was the one single event that has had the biggest impact on Americans and, well, the world for that matter, health and how it affects us. So here is the world's first personal computer. Remember this Commodore called the PET? It was invented and available for purchase in 1977. Was that the main event that changed everybody's lives? How about the incorporation of Apple in 1977? It's the first company that ever was valued at $1 trillion. Not anymore. Their stock took a little bit of a hit, but they're almost there, right? Jimmy Carter was our president in 1977. Is that the event I'm looking for? Is that the big change that impacted everybody's life? It snows for the first time in history in Miami, Florida. I don't know how that would have had any health effect, but you know, it's a record, and so it's interesting. 1977 was when Star Wars was released. Now, perhaps the only impact that this event would have is the amount of soda and pop and candy and popcorn that the people were eating during the movie. Is that it? How about Mr. Roy Sullivan? He holds the world's Guinness record for being struck by lightning 7 times. Oh, man. Now, that's an event that definitely affected his personal health, but what about everybody else's? How about 1977? It's the year that Elvis performed his last concert, and he actually died that same year, 42 years old. Sad. How about some of you comic newspaper readers? 77 was the last year they ended a 43-year run of the comic strip called Little Abner. You younger guys and gals, you have no idea who that was, but you know, being in a newspaper for 43 years, that's a long time. Okay, how about this one? The American government decided that it was time to start telling the American people what they should be eating or shouldn't be eating, and they gave us the dietary recommendations and the food pyramid. Yep, you guessed it. That's the event that literally changed the course of millions of people all around the world, not just US. Now, they did it because they thought and feared that fat was the cause of heart disease. The main focus was, we got to do something about heart disease. It's ticking up, it's getting higher, we're concerned about it, we got to do something. Let's get a bunch of doctors together in a room, and we're going to find out the reason. So they instituted the idea of eating a low-fat and a high-carbohydrate diet would solve this fat and heart disease problem. More people have heart disease today than we did in 1977. And it's not because there's more people in the nation. I'm talking about the percentage of people in the United States and in the world, a higher percentage have it. Now, the difference is more people survive when they have heart disease. They're living while they still have this disease. We've gotten much better at living with diseases, not just heart disease, but all diseases, not curing it or avoiding it, but keeping sick people alive for a longer period of time. We've gotten a lot better at that since 77. Now, this paradigm shift, this idea of telling people what to eat, low fat, high carb, is so systematically entrenched into our system, and it's still here today, that we're going to have a little bit of a battle fighting against that belief, even with the mountains of clinical evidence that we now have, proving that the dietary guidelines of 1977, which are still taught, is absurdly incorrect. So the ideas are so strong at the time, or the force of the American government was so strong, that nearly every country in the world followed our lead. They adopted the same guidelines that of this food recommendation, and they still do today. Now, I will say that a couple of years ago, I'm getting off on a sidetrack a little bit, but it relates. The country of Sweden, I'm actually half Swedish, so yay, Swedes. They were looking at their people and they're saying, you know what? I was going to do a Swedish accent, but you might laugh at me. They said our people are getting sicker and sicker. And ever since we adopted this new policy and following it for 45 years, it's not working for us. We got to do something about it. And so they got a panel together, and they did something that the U.S. has never done. They did something that we didn't do in 1977 when it was established, and they did something that we haven't done since, because the guidelines are updated every 5 years, and we haven't done it what the Swedes did. The Swedes got together and said, all right, we're going to take experts in every field, and we want you to pour over, here's the difference, clinical studies of human beings. They went through 20,000 clinical studies, 20,000. And they said, okay, I think we got it. I think there's a strong message here. The first message is we're going to kick out the old policy that we had. In other words, they're going to kick out the policy of the food pyramid and the recommendations that we follow here in the United States, because they said these 20,000 clinical studies do not support it. There's no evidence. We're embarrassed that we even followed it without any evidence. We just assumed that the Americans did have evidence, which we didn't. It was opinion and correlational evidence studies at best, right? So they threw it out, and guess what diet that they're going to? Now, it's not a true therapeutic carbohydrate diet, which means that they're at 5%, 3 to 5% of their total caloric intake is carbs or less, but they're definitely low carb. They are high fat, omega fats, mostly omega-3. They're basically doing, if you were to take the name off of our program, of the 3 Belief program, and overlaid it on what their recommendation is, it'd be our phase 4. Amazing. Wonderful. Good job, Swedes. Hopefully the rest of the world follows their lead, and I think they will after they start seeing the numbers drop. The issues when I'm talking about the numbers of metabolic syndrome and chronic disease. So let's get back to, even though the main focus at the time in 1977 was to turn the rising tides of heart disease, reverse it, which was, let's give it to them. It was a worthy goal. It's a good thing to have. It has had cataclysmic negative effects on every other health risk factor that we live with, such as obesity. Let's just look at obesity as an example. In 1977, 13% of the population was obese. Okay. Now this report is in year 2000. Okay. I couldn't find one with a cool graphic. So this is 8 to 19 years old already, but it shoots from 13 to 40% are obese. Okay. I don't care what kind of guideline or savings plan you have. If you have, you're saving, or you're spending 13% of your disposable income with the current spending plan you have now, and then you adopt a new program and you're spending 40% of your disposable income and it's not investment on the new plan, that's a reason to get rid of the plan. That's not a good plan. So why would it be any different for our physical being? Now all these things other than obesity, they all flow together. So if you look at this chart here, you have high blood pressure is higher since 1977. Diabetes is higher since 1977. We already went overweight. You have high cholesterol is higher than it's ever been, higher than it was in 77. Two more that are probably the first indications that the diet is not working for Americans is fatty liver. Fatty liver disease is higher than it ever has. And then you have insulin resistant, with half of Americans, half of the world actually, in the latest report, is already now insulin resistant. Now, all these things are correlated together. So these things that we just went through and many, many others have risen substantially since 1977 when the food changes all went into effect. So let's talk more about the insulin resistance. Let's go through the 10 most common signs of PCOS. Now, in the beginning, I talked about Polycystic Ovarian Syndrome. And I want to tie in what studies have found is the correlating cause of PCOS. If you were to Google it, you'd see that still traditional medicine has not adopted the clinical data of what causes polycystic ovarian syndrome. And they call it a syndrome mainly because it's really a series. It's a conglomerate of several other issues. Let's go through them. So having irregular menstrual cycles is one of the signs of a polycystic. A lot of flow during the period, that is another. More hair, but in places where women generally don't want to get hair, facial hair, body hair. To make matters worse, they're getting hair where they don't want it, but they're losing hair where they do want it. So they're losing it off their head. That's not good. Skin discolorations, like rashes and like a weird tan or a staining is one of the symptoms. High blood pressure is pretty common. And every woman's favorite, of course, weight gain is a traditional one. Higher feelings of stress or the inability to cope with the stress that they're having, which often leads to depression. That is one of the increases. Acne, here they are grown women and they're going back to their teens. And one of the most popular and saddest is infertility. Not being able to give birth or conceive while their ovaries are inflicted with cysts. So basically, PCOS is where there are cyst growths, non-cancerous tumors that are growing on top of the ovaries. And they can, if left untreated, it can completely cover the ovary, making it obviously impossible for a sperm to get to the ovary, to get to the release of the egg, so that the sperm can't make contact with that egg and conceive. So let's talk about what the experts have found. What are the people that spend their lives? As recently as last month, January 2019, the very eminent professor Rob Norman, who's been a leader in polycystic ovarian disease in the world for many, many years, has made this statement. 95% of heavier obese women who have got polycystic ovarian syndrome are insulin resistant. And yes, there are some thin people out there that he mentions with polycystic ovarian syndrome, and 75% of the thin women are found to have insulin resistance. So there's a direct correlation to having insulin resistant and PCOS. Okay. Now remember, what is the definition of being obese? It's not as heavy as you might think. It's just 30 pounds over your ideal weight. So you figure out your ideal weight and you're 30 pounds over it, you're medically defined as being obese. Now, simply being insulin resistant is just this as a reminder. Look at those little blue things that look like cup holders. Okay, those are your insulin resistant or receptors that are on the outside of the cell. Okay, and so when the glucose, that's the little blue dots, the blue dots represent your bloodstream or surrounding tissue, and the green dots are insulin. So you have glucose in your bloodstream, and you also will have insulin in your bloodstream. The insulin comes along, connects to that little blue cup holder, and tells the cell, all right, I'm here, go ahead and receive the glucose. Then it can suck down and actually absorb the glucose. Without that receptor there, then the glucose can't be absorbed. Therefore, the glucose is not pulled out of the bloodstream, and so the glucose stays high in the blood, which causes its own problems, right? So insulin resistance is where those blue cup holders don't respond to the insulin anymore because they've been bombarded with it for too long. They're just blind to it. That then means that glucose is not being absorbed and it stays in the bloodstream, causing its own problems. And then the secondary problem is your pancreas starts pumping out more insulin to try to get the glucose to drop, and it just feeds on itself. And that is how insulin resistance starts. And then through that, we get things like polycystic ovarian. So why should you care about it, guys? Why is this an issue? Simply because, like I said in the beginning, we have wives, we have mothers, we have friends, we have sisters. We have women in our lives that have ovaries. And if they're during their bearing years and they nothing is sadder than a young couple trying to get pregnant and they're not able to do it. They're having challenges. So let's talk about what it is and how to prevent it. What do the studies say is the best way for us to get over it? In the meantime, PCOS in the medical community has been pretty much an enigma because we don't really know how is it in traditional medicine, how it's acquired, or do people inherit it? Do they get it from their mother and father? And I'm going to talk about inheritance here in a second. A very fascinating studies have been done on that. There are 100 candidate genes that can be associated to PCOS, but none of them are truly predictive, and several of those candidate genes are the same as they are for, say, type 2 diabetes, and the same one that's for also obesity. So they're not definitive precursors and say, okay, if you have this gene disorder that is connected to PCOS, but it's also connected to diabetes and it's also connected to obesity, which are two completely separate issues. It doesn't mean that if you're overweight or you have type 2 diabetes, you're absolutely going to have a PCOS, or that wouldn't make sense then for us guys, right? So what I'm saying is there's a correlation symptom and it's not an absolute. In general medicine, there's no easy diagnosis for PCOS, and they have no one treatment for it either. There's no one blood type test for polycystic. Some have indicators, right? PCOS presents itself with a spectrum of symptoms like we've gone through already, any of which may be present or absent. Like we talked about, acne can be absent, but they have still the other symptoms, or they're not growing hair in unwanted places. Delayed fertility seems to be one that is universal, right? Which usually is due to the lack of ovulation. Ovarian cysts, little follicles that are recognized through ultrasound, can sometimes show up in a blood test, will reveal higher levels of testosterone. That's one of the ways that they'll see that, oh, I think you have Let's check that a little bit more with an ultrasound if a woman has higher levels of testosterone. Cellular insulin resistance and being overweight, again, are some more of those symptoms that we talked about. The obesity in these people happens earlier, and it happens at a greater rate than it does in those who do not have PCOS. So what I'm saying is that if you're a woman and you're trying to conceive and you're over your ideal weight, your chances of getting PCOS are accelerated many, many times over, and your rate of getting heavier, meaning gaining more pounds in a shorter period of time, increases as you start to get more cysts growing. And so those are things to be concerned about. If you want to conceive, one thing you need to do is really watch that weight. And again, because insulin resistance is connected, it is the precursor, I think we may have an answer, because I think we now feel that we're able to manage insulin resistance. We know how to do it with proper nutrition. Not the nutrition from the paradigm that we've had since 1977, but the one that makes sense from a scientific evidence, like the one that is adopted by Sweden, the one that we talk about here on this channel, rather than from opinion. All these things came from scientific evidence proof. There are treatments that are standard in the medical field for therapies to lose weight or to increase your fertility. They can do it by pill. They can do it by an IV. That's one of the standards for PCOS. But it can create other issues. It can make you have an upset stomach. It can actually induce the higher incidence of miscarriage and upset stomach. And then you run the risk of a woman getting hypertension, and the risk of stillbirth for the child is increased by these treatment therapies for PCOS. So such treatments will also increase the risk of type 2 diabetes. Your coronary artery disease goes up. Increase of cancers go up, and even more events of Alzheimer's later on. So all because modern medicine is using the approach of treating the symptom instead of what caused the PCOS in the first place. And since studies show that those PCOS have all insulin resistance, wouldn't it make sense to treat what is causing the insulin resistance rather than what the insulin resistance is creating, such as the cyst? Why treat the cyst on the ovary? By some will actually go in and physically remove the cyst rather than a treatment for what caused the cyst to be there in the first place, which is insulin resistance. And of course, we all know what causes insulin resistance. It is a diet that is too high in carbohydrates for a prolonged period of time. Now, did I say that we're absolutely certain? That's not necessarily the case, because there are some rare cases that throw a wrench, but the evidence through studies is very, very strong. It's very, very convincing, and the results are much better. I've had people that have come into our clinic over the years, and that I like to call three-belief babies. They were not able to conceive. They came into our program. We reversed their insulin resistance. They lost the weight. They go back to the doctor in a short amount of time. The doctor says, I don't know what's going on. The cysts are completely gone, and they conceive and have a baby. It's great. Now, they didn't name him. They didn't give him the middle name of my name. I'm kind of hurt about that, but, I'm still waiting, still hoping. So the cysts can simply be, just because you have them does not mean that they're there forever. You reverse what caused them, which is elevated levels of constant insulin and insulin resistance, and they'll go away. They'll just drop off on their own. Great work was done by Professor David Barker, which drew an association between birth weight and subsequent early death from heart attack as people got older. That hypothesis from his work in 1980 has grown into the origins of being healthy or having heart disease. Now, what I mean is that suggests that the preconception of time of the parents and the pregnancy time actually create an environment for the rest of the life of that child as to whether they're going to have a long-term good health or a propensity to develop some of our known chronic issues. Okay, he was the first one that did studies to show that it really matters as parents as to what physical shape you're in for the long-term life of that person that you're creating together. So when looking at a sperm and an egg, there is a lot of nuclear material that's going to be passed on from sperm and egg to this newborn infant. Okay, this nuclear material is on the outside of the epigenome as they get together to make the new baby. Right? This is all at the genetic level. This is a collection of chemicals which actually determine how that genetic material is going to be expressed. Meaning, are they going to have blue eyes? How tall are they going to be? Are they going to? What's their teeth going to look like? All those things. When that's happening, there's a lot of nuclear material around this epigenome that is creating the little baby. Right? That expression, what it's going to look like. There's lots, and we don't understand all of it, but we know that there's lots going on. We do know this, that things, different environments that epigenome is created in, smoking, alcohol, nutrition, physical activity, sleep patterns, stress, infections, drugs, all these things have an impact on the epigenomes, which then has an impact on our genetic material as we are creating or growing into human beings. We know, that we're not supposed to drink alcohol when we're drunk or when we're pregnant. You're not supposed to smoke, right? Is it so silly or such a far reach to see that those are the only two environmental issues that are going to affect the health outcome of that child? That's it? Well, that's ridiculous. Smoking is an outside environmental. It causes certain chemical cascades. Alcohol does the same thing. We know that nutrition, we know that certain foods will cause either high insulin or high glucagon, high ketones, low ketones. We know that some foods are more toxic. We know that stress has these chemical mixtures in our bodies. Why would we think that only smoking and alcohol is going to affect the baby? In reference to the brilliant Professor Tim Noakes on this very subject, to help steer me straight and to confirm that what I'm proposing, what I'm saying, pulling these studies together, is that am I correct? And he assured that through all that he has written and all that he's lectured on, that my thinking is correct. If the mother is insulin resistant at the beginning and during pregnancy, maybe a key topic of early pregnancy, what if that growing embryo is in an environment with increased glucose levels? She develops hyperglycemia. That chemical condition goes across to the baby. If the mother has also insulin resistance, that does not seem to cross over through the placenta. Now, what I'm saying is, let's say we have a mother and she is high glucose, she's eating high carbs, not watching her intake. So in her blood level, she has high levels of sugar and glucose. That's going to make high insulin in the mother. So she both has high glucose and high insulin at the same time. We're not seeing that the insulin actually transfers from the mother through the placenta to the baby. But we do see the glucose doing that. So the glucose does transfer over to the baby. But then what happens? The baby now has to deal with that elevated glucose levels in that hyper state. And then the baby's insulin or pancreas has to secrete insulin to match that. If the baby is, of course, developed enough where it has a pancreas that it can start to have beta cells that are producing insulin. If it's prior to that stage, it just has to sit there and grow in a state of elevated glucose. Now, go look up in any medical book and just look in there and see what are the damage done to an adult that is exposed to elevated glucose levels for a long period of time. What are the negative things that happen? There is a list longer than your arm. There are many. So in a baby, it's not going to be any different. And this is before they have the defense mechanisms like insulin to be able to fight them. But once that pancreas in the baby is developed, it's going to start secreting hyper amounts of insulin before it even has a chance to be born. That's why they're saying that there are babies that are being born as infants, seconds after they come out of the womb. They have elevated glucose levels, and they are already somewhat insulin resistant from the very get-go. That is setting that child up for obesity as they get older. You're actually writing into their DNA that, yep, your chances of obesity are markedly higher. Your chances of fatty liver, your chances of high blood pressure, your chances of high cholesterol, and the list goes on. Fatty liver. It's just all those things that happen when we are exposed to elevated glucose and insulin levels is the same thing that's going to happen to that poor little baby. This is the risks of having polycystic ovarian syndrome. Okay. Now, in another book, I'm actually drawing some other conclusions here. Now, this is from a scientific journalist, Annie Murphy Paul, in a book called Origins. Great book. Her assertion from the studies that she gathered of other medical professionals that preconception and during pregnancy may be the absolute most influential and consequential period in a person's entire life. Wow. That's even before the child's born. Now, we already know how important it is. You've heard me talk about how important it is to have proper nutrition, good bacteria for that baby, gut, because of the microbiome as they're growing. Those first 3 to 5 years are critical. Well, in her book, she's drawing conclusions from other studies. They're saying even more important than that is when the baby's in the womb. Huge. Now, we can't do anything about our parents' health when you and I were conceived. It's already been done. It seems true that our biology may be predisposed to be insulin resistant, to be tolerant or not tolerant to carbs as much. But we are absolutely powerless to change that. But we can, through mountains of evidence that we do have the ability to reduce our insulin resistance by the nutrition that we do choose as adults. You need to be willing to adopt the lifestyle that science is telling us that our most powerful weapon against living with chronic disease. What is it? It's there. It's just whether we want to hear it or not. I am less tolerant to eating carbohydrates than my wife is. You've heard me talk about that. When I wrestled and had 8% body fat, and back then I still had little bits of fat on the side, called love handles. This is when I was 191 pounds. I had no other fat, but I had these little love handles. That is my genetic expressions coming out. Could it be that my parents were higher levels of glucose, higher levels of insulin during their diet? I do know that both of them did smoke and drink. Now, I don't know if my mother did so during pregnancy. I can't ask her. She's passed away. But it was common back in the 60s to do that. It wasn't as pronounced as it is now. But I can't do anything about that part. But I can do a part, and I have reversed those symptoms from where they were, where they still are, to the fact that I can give up. I can't throw in the towel and say, well, mom and dad did it to me, I have no hope. I was 280 pounds, had over 10 chronic diseases, and I don't have any now. But I'm still susceptible. I can't go as far with carbohydrates as some other people that are more tolerant because I pay a higher price. So low carbohydrate diets do produce a low insulin diet or physiology in your body. And low insulin is the body chemistry that is the opposite of chronic disease. This is the way and the most effective time to get a person to respond to these things is in the preconception and during pregnancy. So if you know anybody that wants to get pregnant and they can't because of PCOS, then recommend to them a low carbohydrate, low insulin diet. And watch those cysts reduce and disappear. If you have a mother that is pregnant, strongly encourage them to not have a high carbohydrate diet, a high insulin diet. You've heard me I did a whole program about the benefits of ketones in infant children after they're born, but also in the womb. Your baby is living in a sea of ketones. So they're used to ketones. They're not dangerous at all. Their body knows how to use them and use them most efficiently. Okay. So if you're still in your baby making years or have loved ones that are, for at least for their sake, is expose them to some of this new science, this better science, not opinion, not agenda, good, solid recommendations, all based on science. So it's very simple. Teach them to be low insulin and life will be better for everyone involved. So I appreciate you let me talk about PCOS. Guys out there, we have women in our lives. Spread the good news. The rest of you, just live a better life. Live the better life by having lower carbohydrates. When you do go and splurge, my recommendation is why not do an intermittent fast right after? You go out on a Friday night, more carbs, or maybe you drink some alcohol. That's gonna increase your insulin levels. How about if you fast till noon the next day? Clear it out of your system and then go back on a lower carb. I'm not saying don't ever eat carbs. I eat them occasionally as well. I love carbs just like the next guy. So this is the best way not to have that a carb hangover, let's call it, okay, and have it plague your life for lots of time afterwards. So watch and see what it can do to change your life. I'm gonna hop up here and see if there's any questions. I don't have any. I must have answered all of the questions already in the program. Glad that it was of benefit to you. I do have a question here. How long does it take for the cyst to be removed? It's going to be dependent on the person, how many cysts they have, how large of a cyst it is. In the case of the people that come through our clinic, it wasn't very long. It was about 6 weeks, 8 weeks, where the time frame where the people reported to me that they were pregnant. So it doesn't have to take a long time. I think it has mostly to do with how many cysts and how inundated are the ovaries that have to basically disintegrate in an absence of insulin. So good question though. So thank you again. Take care, everyone. Love you, care about you, want you to be healthy, and we'll see you next week.